November 16, 2021.
It is being suggested that the government provide financial help to families to care for their mentally ill and elderly relatives. The suggestion comes as the health minister prepares to go to court to force families to take care of persons abandoned at hospitals and now classified as social cases.
August 18, 2023.
Health Minister Dr. Christopher Tufton says the ministry is attempting to reduce the number of patients abandoned by family members in public hospitals across the island.
Social cases. A major concern for the health ministry, with approximately 10% of hospital bed spaces occupied by abandoned relatives. At the Bellevue Hospital, up to 75%. But why? Here is Executive Director of Mona Aging and Wellness Centre, Dr. Denise Eldemire Shearer.
I actually feel that the abandonment issue that the Ministry of Health is battling with, because when you look at the numbers of older people abandoned in hospital, a lot of it is because the family can't cope. They've had amputations, they've had strokes. There's somebody like you that has to go to work.
Health and Wellness Minister Dr. Christopher Tufton agrees. He says the ministry is responding through partnership to design programs for healthcare workers and caregivers.
The solution to that is to provide a better approach to training relatives or caregivers to provide a more efficient service in the home setting. So that's going to be a big part of the future.
So the Family Health Unit, Ministry of Health, is looking at the training of their community health aides. We've now trained 126. We have one more region to go to, which is to train them in management of persons. So that the informal caregivers, and we include the social workers, Ministry of Local Government, Ministry of Health, and church groups, to do more home visiting to check on the caregiver. A visit from a CHA to make sure that the caregiver is coping.
Once they are in the public system, they're normally attached to a health center. And if the doctors or the nurses in that health center discern that a home visit is necessary, then the community health aides can be dispatched to provide periodic visits.
We do a lot of public education. We do a lot of seminars. We have been doing some webinars with the Ministry of Health. It's in its infancy, definitely not there yet, but I believe that a start has been made. We don't limit the training, so we say we are providing training for caregivers. So anybody can come to the sessions.
Karen badly needed guidance from health professionals.
One of my main problems was that I was thrown into this role. I didn't get enough guidance from the oncologist. I was just thrown in there and sink or swim. I didn't know anything about changing stoma bag. At one point in time, I had to go read up on stuff like a medical person, because I didn't know what was happening. I had to seek information from another doctor when stuff started happening. I said, what is this? And she said, this is a fistula. I said, what name fistula? And she describing it because the fistula come in like a volcano. Me not have them kind of training there at all for it.
I believe when your days down here are through, there's a place up there for people like you.
In Canada, home care is a major part of the health plan. Provincial programs like Ontario Health at Home provide patients, families and caregivers with in-home and community-based health and well-being services. Team Assistant Selena explains how the program works.
So if the person requires personal care or medical services, that's covered under the Ontario Health Insurance Plan, then it'd be for free. But just that we need to do an assessment to determine if they're eligible or not. So it depends on what type of services they need.
She says with a valid Ontario Health Card, personal care services are provided for as long as needed. Marie Anderson benefits from the program.
My mom is bedbound. Her care is 3 times per day, 7 days per week, 2 hours in the morning because, you have to do bed, bath and feed. For the afternoon and evening, 1 hour each because there's nothing much to do there more than just pericare, dental and so forth. So that kind of helped me not to be overly stressed because it can be very overwhelming when you have to be working full time and to come home and also be the primary caregiver for your loved one. It's like about 75-80% on them and less on me. So I really get the help, so it alleviates my stress.
In a smaller economy like Jamaica, the government is offering financial support in the following ways.
Well, we have various windows to offer financial support, but I'm not sure about caregiver support outside of what is currently offered through the community health aides. When I became minister, we had less than 1,000. Today we have over 2,000, and a big part of their work and their training is to serve communities in their setting, in their home setting, and that is clearly paid for by the government. So that would represent some sort of financial and psychological and clinical support. Beyond that, yes, the medication, but if there are procedures to be done, there's a compassionate grant that one can apply for and get financial support for any specialized services.
Health and Wellness Minister Dr. Christopher Tufton. Ainsworth and Karen were not aware of these support initiatives. There is yet another hurdle that caregivers face: balancing care duties with full-time jobs. The Caribbean Policy Research Institute, CAPRI, last year launched a report titled Outside In, Increasing Participation in the Labor Force, which revealed that some 15,000 people are unemployed due to care responsibilities, but they want to work. One of the main reasons for their unemployment is the lack of workplace flexibility, including the availability of part-time jobs that would allow caregivers to balance work and home responsibilities. Ainsworth was one of the lucky ones.
I think faith would have intervened at some point as I was transferred from one division to a next division shortly before. Work starts at 7. But I spoke to my superiors and they allowed me to come in at 8 o'clock. My supervisors allowed me only to work Monday to Fridays and not give me any of the weekend supervision duty that we are required to do. They understood. They were there with me through everything. Being there was much easier for me to take care of them because I'm able to come home at nights.
Lead researcher Dr. Kelly and Dixon Hamil offered this recommendation.
Let's issue vouchers to persons who are employed, who have these care responsibilities, and that the vouchers can be used to subsidize the cost of care at whether it's daycare or places of care for the elderly, so that they can go to work. But in addition to bringing them into the labor force, it means that we're also now formalizing the care economy and that care industry, because the vouchers could only be used at registered and regulated care facilities.
She says the idea is not novel, as the UK and Mexico offer a subsidy for child care services. Additionally, in the United States, there are provisions under the Family and Medical Leave Act, FMLA, that provide certain employees with up to 12 weeks of unpaid job-protected leave per year. Not restricted to the birth and care of a newborn, the time may be used for care of an immediate family member, a spouse, child, or parent with a serious health condition. Dr. Eldemire Shearer believes more can be done.
Where I went is that if you say a child is sick, you can get as much time off as you want. Everybody's sympathetic. But if you are looking after a person with a disability or an older person, why aren't we as tolerant? I would like to see the permissions for leave in particular. Flexi work week. And if you notice, I'm staying away from provisions that have high costs. But I do think more can be done.
Then this announcement on September 1, 2025 by then-Senator Kamina Johnson-Smith.
We plan to modernize the flexi-work legislation that exists and ensure that we have models of work that are more sensitive to the fact that many women are in what they call the sandwich generation, where they are not only taking care of children, but they're taking care of aging parents. We know that a lot of this quote-unquote unpaid work falls on women. And so the modernization of the flexi work program is going to take cognizance of the fact that working women with these unpaid responsibilities as well do need more flexibility. And we want to engage with the private sector on that, and also make sure that we have systems where the public sector leads.
When you're tired of being strong.
There are simple ways to ease the caregiver burden. Help from friends, neighbors, or church groups can make a major difference.
Sometimes all they need is a break, just to recalibrate, to refocus, to breathe, to refresh, and then start again. They can do tangible things. They have the means of providing food because the caregiver might run out of resources. Find out from them, what do they need? How can I help? Help with the laundry, help with medication if they can. Come let me do an errand for you. I'll help you clean. I'll accompany you to the hospital. I'm going to stay for the next 3 hours. Just go and get a walk, get some sleep. I am here and I'll tell you what. All those things are important.
Clinical psychologist, Dr. Paul Smith. And for Dr. Eldemire Shearer?
I think as a country, we need to look more at activity centers. I'm not calling them daycare centers because it's about being with people that are similar to you, have similar interests. And so I think we need more activity centers. It could be that a community uses their community center twice a week, working with National Council for Senior Citizens, working with social workers, and have group activities for 3 or 4 hours a day.
Care facilities like the Golden Resort Nursing Home offer daycare services for the elderly. Nurse Anne-Marie Colquhoun Phillips said the option is, however, not taken up.
You want to go vacation with your husband or family member. You have an elderly who is not mobile. So you have to take them to somebody like a daycare for the weekend to take care of them. Yeah, we advertise it, but we don't really get much call on that one.
For those who are able to afford it, full-time nursing care facilities are also an option. However, for Ainsworth and Karen, they wanted their loved ones to be in the comfort of their own homes. And even though they were able to afford the help, the burdens still existed. Dr. Eldemire Shearer had this final word for caregivers.
It's a part of the life cycle. It can be very rewarding. It can be very taxing, but you have to recognize that there are stresses and there are burnouts and to do something about it. Give yourself permission to feel exasperated, do something about it, and then get back to the caregiving role.
Reliving the moments with Ainsworth and Karen made them realize the emotional impact caregiving had on them.
When I look back, sometimes I say, how did you do it? Because I don't know how I do it.
Karen.
Looking back, I was on my own. Even though my daughter would be here, basically on my own after my wife left and went back home. Nobody was looking after me. And I didn't even realize that.
And Ainsworth. For me, after mounting health challenges that I could no longer handle, the inability to balance care and work, and the psychological impact of providing care, I made the difficult yet responsible decision to place Mom in a nursing facility.
When I was caring for you, who would you say was caring for me?
How much you care for yourself at the same time?
You've been in the dark with your restless heart long enough, waiting for the light with your eyes shut tight and your wings wrapped up.
My mom died on July 10, 2025.
I always knew there'd come a day I'd have to watch you fly away.
Taking you beyond the headlines with Unsung Heroes. Who cares for the caregiver? I'm Deidrean Gordon.
So fly, fly,